health history. I'm a graduate student in UIC's nursing program. So, what's your reasoning for coming in today?
Annual school physical.
Okay. Um, have you got your shots recently when you were in school, or do you remember getting any kind of shots when you went to the doctor's office?
Yes, when I first started school.
Okay, so it's probably on file. Do you have any allergies to any foods, latex, medications, or anything that you know of?
No.
Okay. Have you had any hospital visits, stays, any kind of surgery procedures that you are aware of?
No.
Okay. Have you had any kind of injuries, like any accidents or anything?
No.
Okay. Are you taking any kind of medications that the doctor gave you, or anything that you might be taking over the counter?
No.
Okay. If you have any other questions, you can just stop and ask me anytime, okay? Okay. Do you know, like, if your family has any history of any kind of health conditions that you aware of?
No.
Okay. Do you know if any family members have had like any allergies, asthma, high blood pressure? I think your notes said your mom has high blood pressure, heart disease, stroke, diabetes, cancer, thyroid disease, blood disorders, obesities, vision, hearing problems, genetic disease, any seizures, emotional problems, mental illness, learning disabilities, or drug or alcohol abuse?
No.
Okay. Who lives in your home?
My mom, my sisters, and my brother and my grandmother.
Okay. And where does your mom or your parents work at?
My mom works at the hospital as a dietary.
Okay. And I think your insurance information is on file. What grade are you in?
I am a sophomore at Thornridge High School.
And okay. And who usually handles your what do you do like at school? Are you in any kind of after school activities, or
Band.
you in band? What instrument did you play?
Flute.
The flute. Okay. Do you drink or smoke any tobacco or anything, or take any drugs, recreational drugs?
No.
Okay. Do you have pretty good sleep habits? Do you wake up at night in the middle of the night, or you sleep like throughout the night?
Sleep throughout the night.
Okay. So what do you pretty much do for like exercise? Like, do you
Take a walk around the block.
just a block? You probably watch TV most of the time. What's your how many meals a day do you normally eat?
2.
2. What you normally eat for breakfast?
Cereal.
And you eat dinner, or just breakfast and dinner, or
Breakfast and dinner.
dinner? What do you usually eat for dinner?
With what my mom thinks we'll eat.
Okay. Do you have any concerns about bullying, anxiety, or any school problems?
No.
Okay. Have you ever witnessed any kind of violence, or you've been in any kind of violence?
No.
Okay. When you usually get in a car, do you usually put on your seatbelt in a car?
Yes.
Okay. You don't usually work out any kind of health hazards, like polluted areas or things that's like hazardous or anything?
No.
Okay. Do you have a specific religion that you go by, or just whatever your parent goes by?
What my parent goes by.
Okay. Hey, do you have any fevers, chills, night sweats, anything that's going on with your weight change?
No.
Okay. Do you have any pain from 0 to 10? What's your pain level?
0.
Okay. Do you have any conditions or change in your skin, nails, or anything like with the sun? No. Okay. Do you have any conditions or issues with your scalp?
No.
Do you wear glasses?
Yes.
How long? When was the last time you had an eye exam?
Before school started.
Before school started, and you just can't see far.
Yes.
Okay. Do you have any issues with your hearing? Any kind of dizziness, hearing aids or anything?
No.
Okay. When's the last time that you had a cold or anything? Been sick?
A month ago.
A month ago. And what was that? Just like just a little cold, lasted a few days.
It was a fever.
Just a fever. Okay. Do you remember what was your temperature?
99.
99. And how long did it last?
A week.
A week. You had a fever for a whole week. Did you go to the hospital?
Yes.
And what did you have? What did they say that what was wrong with you?
It was just a high fever, but I had to take the COVID test.
Okay, but you had to take a COVID test, and that was what?
Negative.
Negative. Okay. You brush your teeth regularly. When's the last time you've been to the dentist?
Before school started.
Before school started. Okay. You don't have any stiffness or swelling in your neck?
No.
Okay. You haven't had any lump or soreness or anything in your breast or any kind of discharge?
No.
Okay. Have you had any cough or sputum or coughing up anything?
No.
Or wheezing?
No.
You said you didn't have any asthma, okay. So you haven't had any chest pain or anything going on there?
No.
Okay. Have you had any, is your bowel movements usually regular? Have they been regular? You haven't had any issue, constipation or diarrhea?
No.
Okay. And when you urinate, is it pretty regular? There's no kind of discharge or any burning or anything?
No.
Okay. When was the last time of your period?
August 1st.
And how old were you when you started your period?
11.
And everything's okay? You don't have any complications, any cramping or anything with that?
No.
Okay. You don't have any kind of limitations to your, rotation, like your arms and stuff, your legs or anything?
No.
Okay. You haven't had any head injuries, loss of consciousness, loss of coordination,
No.
dizziness, numbness, headaches?
No.
Okay. You don't have any kind of histories of having anemia? The doctor ever told you, or blood conditions or anything they might have told you?
No.
Okay. Okay. Did you have any questions about anything?